Welcome to the second seminar of the KSU CAHIMSS series in Health Informatics. My name is Chris Hudak, and I'm the Presentation Coordinator for Health Informatics, and I'm also your instructor for today. I'm going to talk to you a little bit about the alphabet soup of HI certification and help you move through some of the problems or concerns you may have about this particular issue in Health Informatics. So the first question is, why get certified? Well, in terms of benefits for you as an individual, it's professional recognition, it's career advancement, it improves your earning potential, it will give you much more mobility in your job, and it will be able to allow you to connect with your peers, those people that are certified at the same level you are. In terms of employers can know that their competence level of their staff will be increased, the credentials will be certified and standardized across the board. Staff will work more efficiently. You'll reduce the costs associated with training new staff, and also the employers can ensure the competencies of the individuals. So the bottom line is that once you have a certification behind your name, it allows you to work in an area for which you have been trained or educated, and it allows you to share information with your peers. The harder question to answer is, which certification should I pursue? And that really depends upon your education, your experience, your job function, and unfortunately it depends on your funds. The other thing that happens is that organizational culture comes into play. So if everyone in your organization is certified at the CPHIMSS level, or everyone is certified at the RHIT level, then there may be some pressure on you to certify at that particular level. But again, it depends upon a number of different things, and you have to think about that. What my idea is today is to share with you all of the different certifications that are available, and then help you pick a certification that you would enjoy. So what you see in front of you on the screen right now is the number of HIT certifications that are available. And when I said alphabet soup, I absolutely meant alphabet soup. These are divided in a way that I think is the most important, and you'll see on the right-hand side of this particular diagram, CPHIMSS, CAHIMSS, and RNDC. And those three certifications are the ones that are going to give you the most bang for your buck. They are not cheap. They do cost a fair amount of money to test and to maintain, but those are the ones that are actually the industry standards at this point. Obviously, the RNDC, you have to be a registered nurse to get that credential. But the other two have specific degree requirements and specific experience requirements. On the right-hand side, you see CPHIT, CCA, CHCA, and a number of other different certifications. These certifications are very specific for jobs. So the right-hand certifications are the ones that are more general. The ones on the left side are much more specific. And we're going to talk about each of these certifications, not in depth, but enough so that you'll get the gist of what they all are doing. So let's try and make sense of all of this. And we're going to do this by dividing this into two different sections. There are nonprofit organizations that offer certification, and there are for-profit organizations. And the nonprofit organizations that offer certification, you'll see here by their acronyms. The American Health Information Management Association deals primarily with those certifications for medical records and medical technologists. The American Nurses Credentialing Center, obviously, for nurses. The American Society of Health Information Managers is an organization that deals with folks who work in both technology as well as healthcare. HIMSS, or the Health Information Management System Society, is the biggie. This is the one where most of the certifications are, and this is the one that certifies you as a generalist, and also one of them that brings the most value to you and to employers. And finally, we have the Office of the National Coordinator of Health Information Technology. And we'll talk a little bit more about that when we get to that particular section. But this is certification that is available to students who are in the grant program at 92 community colleges across the country. These were part of the high-tech grant and part of the grant that allowed people to become skilled in managing specific areas of health information technology. And those particular areas were then moved into the American Health Information Management Association. So now the Office of the National Coordinator and the American Health Information Management Association tend to offer some of the same certifications. And we'll clear that up as we go through. The for-profit organizations that offer certification are Health IT Certification and New Horizons Computer Learning Center. And one of the things you need to know about is that these organizations offer you certification, but you cannot usually sit for their certifications unless you've taken their course. This is why they are for-profit organizations. And again, if you want certification in a particular area, or you're not a member of CAHIMSS or AHIMSS or any of the other organizations, this might be a way for you to go. The biggest problem right now, particularly with New Horizons, is that most of their computer learning is focusing on things like Microsoft and Cisco certification, and very little right now on health information management. But I put them up there so that you would know that they're there. So let's talk a little bit about the individual not-for-profit organizations. AHIMA, or the American Health Information Management Association, offers 3 types of certification. They offer certification in health information management, and that is the Registered Health Information Administrator and Registered Health Information Technician. They offer a certification in coding, a Certified Coding Associate, a Certified Coding Specialist, and a Certified Coding Specialist position base. They also offer specialty certifications, a Certified Document Improvement Practitioner, a Certified Health Data Analyst, a certification in Healthcare Data Privacy and Security, and a Certified Healthcare Technology Specialist. And this last certification is a certification that is still offered for free to folks who finish the community college program in the Community College Consortium. What's important to think about in terms of the HIMA is that the Health Information Management certifications are those that are primarily offered, and the test can only be taken if you are a medical records person, if you have gone to at least an associate degree program to be either an RHIA or an RHIT. The coding specialists are those folks who are working with ICD-10 codes, or ICD-9s at this point. And the Certified Coding Specialist position base is a coding specialist that works primarily in a physician's office as opposed to a hospital. Again, the specialty certifications are certifications for folks who work primarily with medical records as opposed to those people who work with systems. So most of the certifications are primarily for graduates of HIM programs. All except the Registered Health Information Technologist, the Certified Coding Specialist, and the Certified Coding Specialist position require at least an associate degree and relevant professional experience. And I will tell you that typically folks in health informatics do not certify in these areas, because health informatics staff and medical records and health information management staff frequently do not mix in a hospital setting. But if you have this background, if you want to sit for these certifications, this is something that would be valuable to you. But I will tell you that both the coding specialist and the registered health information technician are folks that will be stuck in a medical records department as opposed to being in a health informatics department. The second nonprofit I want to talk about is ANCC, or the American Nurses Credentialing Center. And the mission of ANCC is to promote excellence in nursing and healthcare, and to do it through credentialing programs. And they have several levels of credentialing. But the one that we're going to think about most importantly here is the recognition and certification of individual nurses and nursing informatics. This is specific to registered nurses. You get a credential that is called RNBC, which is Registered Nurse Basic Certification. And there is no upper or lower level of certification from the American Nurses Credentialing Center. It's strictly one level. There are eligibility requirements, and obviously you have to have an active RN license. You must have a bachelor's or a higher degree in nursing or a bachelor's degree in a relevant field. And that can be medical technology, social work, any other degree as long as you are a registered nurse. You have to have 2 years full-time practice as a registered nurse, 30 hours of continuing education in informatics within the last 3 years. And then there are practice requirements ranging anywhere from 200 hours of practice if you have gone to a formal informatics master's program to 2,000 hours of practice in informatics if you are simply coming in with 30 hours of continuing education. So unless you are a registered nurse that is listening to this broadcast, this is not a certification that you can obtain. But if you are a registered nurse, it is one more credential that will be useful to you in terms of moving through and up the ladder for health informatics. AHIMSS, or the American Society for Health Information Managers, is an organization that primarily represents people that do technology first and health informatics second. If you're going to sit for the certification for AHIMSS, you have to have skills in computer science, healthcare regulations, data security, data mining, health insurance billing, operational principles, basic medical terminology. If you can demonstrate those skills either through work or through education, you are eligible to sit for this particular exam. The credential is called CHISS, or Certified Health Informatics Systems Professional. You must have 3 years of experience in hardware, software, data, or IT training. And if you do have some pre-existing certifications, such as a Cisco certification or certification in Microsoft or SQL, the experience requirement can be waived. AHIMSS does have courses that you can take, and in that case, it becomes a for-profit organization. But the majority of folks who sit for the exam at this particular point are folks who have experience and who simply take the exam. Now, the gold standard for certification in health information management is through HIMSS, the Health Information Management Systems Society. And for those of you that are students in the health informatics program, unless you have a large amount of experience, the certification level that you would be looking for is the CAHIMSS, and that's the Certified Associate in Health Information Management Systems. The CPHIMSS, the Certified Professional in Health Information Management Systems, is designed primarily for people that have at least 5 years experience and a bachelor's degree. If you have less than 5 years experience and you are graduating from an associate or a baccalaureate program, you are eligible to sit for the CAHIMSS. And the CAHIMSS exam and the CAHIMSS certification is designed to be a fast track towards the CPHIMSS credential. It gives you sort of an in-between credential, which allows you to focus on getting experience and moving forward to the CPHIMSS. The Certified Associate is designed for emerging professionals. It's a career pathway, as I said. And this certification is brand new. There's only 154 people that have been certified. And 134 of those were certified last year at the HIMSS conference. So this is a brand new certification, and one that we are going to be telling all of the students about that are in programs within the greater Cleveland area. So if you happen to be a student in the Kent program or the BW program or any of the programs that are out there, this is the credential that is designed for you. If you do not have healthcare experience and you want to work in a healthcare setting, this is the credential. If you're a mid-level professional and you want to change your career, if you're a clinician and you don't want to gather the experience, but you just want to learn more about health IT, this is your credential. Folks that work in other departments, but they're extensions of information technology. So, for instance, if you're a dietitian, but you're working with the IT department to implement the nutrition information system, this would be your credential. Students in academic programs, and indeed one of the things that we are doing in our program is we're going to make all the information available to our students. And if you're a veteran returning from active duty with experience in health information systems, this is the credential for you. Now, the CPHIMSS credential, the Certified Professional in Healthcare Information and Management Systems, is really, again, the gold standard of the gold standard. This is a professional certification. It is the one that is looked upon very favorably. If you're working in healthcare information in a management capacity, one of the things that CPHIMSS does is it does help you get a job. So this market is becoming increasingly competitive. And if you are CPHIMSS certified, you can get a job sooner than someone who is not. Your career opportunities are virtually unlimited with this certification. What this says, once you retain or obtain this credential, is you're validating your knowledge, your competency, your credibility, and your ability to do the job and to work in health information. It gives you skills and tools so you can make a difference in your organization, your community, and again, it gives you access to all of the skills and tools from HIMSS. And also because it requires recertification every 4 years, it demonstrates your commitment to continuing professional development. And that's something that's looked upon very kindly and very appropriately by employers. So the CPHIMSS credential is the one that students in health informatics programs should strive for. You do need a fair amount of experience. You have to have a bachelor's degree or an international equivalent. You have to have 5 years of experience, and three years of those experience must be in healthcare. Or you can have a graduate degree plus 3 years in IT with 2 in healthcare. So the requirements to sit for the examination are fairly stringent. One of the things that CPHIMSS does is it allows you to look at health IT in other countries. There is an international component available for CPHIMSS. If you are a Canadian listener, you have CPHIMSS-CA certification because of the differences in the healthcare system. And that is the only difference in the exam, the way that billing and coding is done in Canada or other countries as opposed to the United States. So that's the only difference in the actual exam, is the healthcare system. So the benefits, well, I could tell you about them because I've been CPHIMSS certified for 7 years. It does help advance the profession. We're the ones that they call on to write the exams, to help people present at HIMSS conferences. It demonstrates your job-related knowledge, your skills, and your abilities. And it does say that you are competent in doing your job. And so in terms of the benefits to you, it is probably one of the things that you could do to make yourself much more valuable to the organization, as well as making yourself more valuable on the job market. One of the things about CPHIMSS certification, because HIMSS is so influential within the healthcare arena and healthcare information management arena, it's becoming the industry standard. And I have been in organizations where folks who have the certification get promotions or get new positions over people who do not. There are some organizations, particularly organizations that are level 7 in their health informatics implementation. They're requiring their candidates for jobs to have the certification, and they're paying for existing employees to take the exam as well as to take the certification courses. I think what you're going to see with the implementation of the CAHIMSS is you're going to see really most of the other certifications going by the wayside, and you're going to see CPHIMSS becoming much more important. So let me talk a little bit about non-master's, non-bachelor's degrees and the kinds of competencies, exams, and certificates that students in those programs got and will be able to get. In the 2009 American Recovery and Reinvestment Act, there was $118 million put away for healthcare information technology. And part of that program was the health IT workforce. And the idea was to train 50,000 people in healthcare information technology, and to do that at the community college level. These were not associate degrees, these were simply courses, they were workshops. And those folks who went into these programs went in free of charge. There were 82 community colleges nationwide, and each of those community colleges trained for 1 of 6 roles, possibly 2 of 6 roles. If you took this program and you have not taken the HIT Pro Competency Exam yet, you would now be taking it through the American Health Information Management Association. And your credential would not be HIT Pro, it would be CHST. So the non-paying certifications that were available through the American Reinvestment and Recovery Act have now switched over to a certification through another agency. But for those people who completed the program, that certification is still free. If you've trained elsewhere or you have professional experience, you can sit for these exams, but it will now cost you. The 6 roles that were looked at that the HIT Pro exams trained for were practice workflow and information management redesign specialists, clinician practitioner consultants, implementation support specialists, implementation managers, technical software support, and trainers. And we have many people in our program at CAHIMSS who have taken these certifications and who are now in our master's program and who have received graduate credit because they have been certified. Now, as I said before, it's been converted to the CAHIMSS CHTS, but again, there are still folks out there who have not taken the exam, so you can't sit for these exams. Now, let's talk a little bit about the companies that do this for profit. Health IT Certification is a company that was founded in 2004, and they had originally 2 certifications, Health Information Technology and Electronic Health Records. Again, they have their own curriculum and they train people through their own curriculum, and then that allows you to sit for their examinations. They have put approximately 3,600 people through their program since 2004, but for the most part, these certifications are not looked at in terms of career advancement because they are not a degree-granting institution. So the Health IT Certification Company is independent of the government, so it's not OMC. It is independent of a membership organization. And so it is just a company who trains you, who then allows you to sit and take their examination. Health IT Certification has 4 certifications. One is the CPHIMSS, or the Certified Professional in Health Information Technology, and you'll see the description underneath it. But essentially, this is someone who works primarily with any HIT, including e-prescribing, telehealth, electronic health records. It's sort of a generic certification. Then the HIT Health Information Technology certification has a Certified Professional in Electronic Health Records, and that's a CPEHR. So what those folks do is they work with hospitals and long-term care facilities who are implementing electronic health records so that they can get the most benefit out of them. And one of the things that these CPEHR professionals do is they work with the institutions to achieve meaningful use incentives. And these meaningful use incentives, as you guys all know, translate into funds and money for the hospital or the agency. So this is becoming a very hot certification if you are not certified, if you're not CPHIMSS certified. The next two certifications that this company offers is a Certified Professional in Health Information Exchange. And these folks are certified to work only with health information exchanges. And they do the planning, the selection of the software, the implementation at the state level or regional level. And then the newest certification, and you can make your decisions about how useful this is called the Certified Professional in Operating Rules Administration, or SAPORA. And these professionals that take the course are primarily responsible for implementing and maintaining operating rules for health plans, like third-party insurance payers, Medicare, Medicaid, Aetna, Anthem. And what they're looking at are the processes and the transactions of administration that meet the requirements of the Affordable Care Act. So with the implementation of the Affordable Care Act and the folks that are now signing up for the insurance, these professionals are being hired. The problem with any of these specialty certifications, whether it's HIE or EHR or Operating Rules Administration, is that once that process is over, if the organization thinks that those processes are going to be self-replicating and are going to run on their own, these people may not have jobs. And so the generalist certification is far better than the specialist certification. But again, if this is something that you're currently doing, if this is something that your organization wants you to do, it's worth taking a look at. But do remember that in able to certify for these, you have to take the course from the company also, which runs into a little bit more money than some of the other certifications. The next for-profit certification mechanism is a company called New Horizons Computer Learning Center. And they have 30 years of experience in computer-related education. Before they got into the medical billing and certified professional coders, they actually did a lot of training on Microsoft products, Cisco products, any of the companies that were out there that had training available for their particular computer system. So they would have network administrators, LAN administrators, WAN administrators. Indeed, if you go to their website right now, you will have to ask them for specific information about the certified professional coder, the certified billing and coding professional, and the certified medical administrative assistant. These three roles are primarily for medical billing, and these three roles are extremely specialized, working with ICD-10 or International Classification of Disease version 10, working with particular billing types and billing codes, and working with administrative assistants to oversee these billers and coders. Again, New Horizons does their own curriculum. These three medical billing coding certifications are not readily available on the website. You do have to ask them and to say, I am interested in these particular ones. Again, you must take the course as well as take the certification test. So the question with any of these certifications that are available is, why bother and how much will it cost? Well, why bother? The question is, if someone is interested in moving the profession forward, in moving their own role forward, in making themselves more valuable to the organization, then you certainly are going to go with a professional certification. But you want to do that at a more general level. If you are a student and you're just coming out of school, particularly a bachelor's or master's program, I would certainly urge you to look at the CAHIMSS certification and to try and figure out what experience you would absolutely need to be able to move to the CPHIMSS certification. Some of these particular certifications are job specific. So if you are in medical records or otherwise known as health information management and you want to stay there, then certainly you would get that particular certification, and that would be the RHIT or the RHIA. The memberships in professional organizations offer you the ability to take these certifications at a more generalized level, and it does give you much greater ability. So I would urge you to, first of all, join the organization, and second of all, to look at the certifications and see if they're right for you. Don't try and get all of them. One of the things that people have said is, I'm going to get all of them, and I can do anything in HIP. And one of the things you don't want to do is collect credentials after your name. So if you're CAHIMSS, certainly go for the CPHIMSS. If you're RHIA and you want to do CPHIMSS, fine. 1 or 2 credentials are fine. But don't collect credentials and don't try and get them all, because you'll run out of money and you will certainly run out of time. The other issue is that if you are looking for the gold standard, and again, I will put a disclaimer out there that I may be a little chauvinistic because I hold the certification through him, but that really is the one that makes the largest difference in terms of people's upward mobility and the ability to get jobs. So what I put at the end of this presentation, for those of you that would like, is I just put the website up here where you can go for more information on the certification. Again, AHIMSS, American Health Information Management Association, American Nurses Credentialing Center, American Society of Health Information Managers, those are nonprofits. HIMSS, the Healthcare Information Management System Society, and the Office of the National Coordinator, those are nonprofits. And finally, Health IT Certification and New Horizons, both of which are for-profit organizations. I'd like to thank you for being here, and I'd like to thank you for listening to the presentation, and we hope to see some of you again in our next webinar.